Well, hello, everybody. Thanks for joining us tonight for our webinar on 5 steps to better brain balance. I just wanted to talk to you a little bit, just a few things before we begin. I'm Lexi, the co-host for tonight, and I just wanted to draw your attention to the right side of your screen. There is a chat feature that I would encourage you to use if you have questions. You can message me directly, or you can make them public so that other people can see your questions as well. And we'll do our best to address them as the webinar goes on. This webinar will probably last about 45 minutes or so. So we'll do questions throughout and then some at the end as well. So one other thing I wanted to draw your attention to before I introduce the speaker is the offers tab, and I will include this in the chat as well. We will review the offer at the end, but it is posted in there too if you'd like to take a sneak peek. It opens to a new tab when you click on it, so you can simply kind of toggle between the two tabs as you want. But we'll touch more on that later on during the webinar as well. So again, I'm Lexi, the co-host, and to introduce our speaker tonight, his name is Dr. Eric Starr. He is a board-certified chiropractic neurologist at Team Healthcare Clinic. He works with a number of different brain-based conditions: ADD, ADHD, autism, depression, anxiety, sleep disorders, concussions, and more. And he's kind of our go-to neuro guy in the clinic, and he'll be the one presenting and talking tonight. So welcome, Dr. Starr. You can take it from here.
All right. Thanks, Lexi. Welcome, everyone. Really excited to be here with you guys tonight. As Lexi said, there's a chat feature on the side, and so feel free to use that at any point tonight. And I want this to be conversational and for you guys to learn, and so feel free to shoot questions out. I'll do my best to get to those and answer as timely as I can as well. Two kind of promises I have for you guys as we enter into tonight. First is I really want you guys to come away learning something new tonight, and so I trust that at the end of this that you will. And my second promise is that I want to provide an opportunity for you to get help, and that's what I'm here for, and that's what we at Team Healthcare Clinic are here for, is to help our patients to get better and get well. And so again, especially in this realm and area of brain health and brain-based care, this is really where my passion lies. And so really, I want to start by taking you on a journey. We're going to take you on a journey tonight, just in terms of how we as a clinic and myself as a provider have learned over the years of practice what it is that's allowed us to be successful when it comes to brain health for patients, how we can improve brain health. And so it all kind of started, actually, you can see this picture here on the screen, started all back when I was in chiropractic school. And this is actually out in Portland, Oregon. And so this is where I did my grad schooling. And it was really here that I learned not just my chiropractic skills, but also started to learn more and more about what was called functional neurology or chiropractic neurology. And so as I learned more and more about how to take care of musculoskeletal injuries, necks and backs and ankles and shoulders, I started to learn about what it was like to actually handle and take care of patients who were dealing with balance and dizziness issues or anxiety and depression. And it was really through this process that I started to gain just a deeper understanding, certainly, but also just a deeper passion and desire to help patients with maybe more than just a typical neck or back injury. How could I help a patient who, man, they just have no understanding of where they are in their environment, and they're constantly dizzy or imbalanced, a patient who has mood issues, and maybe a patient that can't function due to poor focus or concentration. And so it really led me and drove me to learn more about these brain-based conditions. And these certainly have become more and more of a prevalent issue in our society today. And so as we hop in here, let's take a look just at a few statistics. And these are really, really staggering and surprising and continue to grow year by year. And so let's walk through these together. So 1 out of 6 Americans takes a psychiatric medication. The major depressive disorder is the leading cause of disability in the US, ages 15 to 44. So this is affecting 16.1 million adults, probably even more than that right now. Anxiety affects 1 in 4 teenagers in our society. 1 in 5 kids has a neurodevelopmental disorder, and this includes ADD, ADHD, autism, and many more, OCD, dyslexia. Now, what's intriguing is that this statistic, maybe 10, 20 years ago, was at about 1 in 100. And we go back 20, 30, 40, 50 years, and this was 1 in 1,000, 1 in 10,000 kids were struggling and dealing with this. And so we're seeing a trend, and it's really become its own epidemic in its own right, that we're seeing more and more kids that are struggling and dealing with these neurodevelopmental disorders. And so again, this is what has been a part of driving me towards gaining a deeper understanding of these areas. 1 in 5 high school athletes will sustain a sports concussion during the season. Now, 90% of these don't even involve a loss of consciousness. And so a lot of times patients think that they need to be knocked out or black out or see stars or any of these to consider a concussion, and it's not the case. It can be from a simple tackle in football that doesn't necessarily knock someone out. It can be from a car accident, a whiplash injury, where that brain is moving around inside of that skull, and that's enough to cause damage and dysfunction to the brain. And so these are just really, again, staggering numbers, but also shows the importance of brain health and brain care in our society, and that we're taking care of our brains. Now, I want to share a little story as we get going, and I want to talk a little bit about this patient here. And this is Carly. And Carly, when she was born, actually was born with cerebral palsy, and so she actually was missing a significant portion of her brain. And her parents didn't know this, and she actually was adopted, and so her parents didn't know this, but what they started to find out as she grew the first few months of life, that something wasn't quite right, and she wasn't developing properly or appropriately. And so they brought her in, imaging was done, and they found that she was again missing a significant portion of her brain. And so the doctors said she would probably never be able to walk or even talk or feed herself or dance or play sports. And it's hard to fault the doctors at that time. They just didn't know the capabilities of the brain and how we can again make changes to the way that the brain functions. And so over the course of Carly's life, she has gone through many different forms of therapy and care, some of which in our clinic. And with time, we started to see improvements in Carly's ability to function in day-to-day life, to the point where, as you can see here, she's actually, this picture was taken at a softball game of hers. And so Carly talks, she feeds herself and dresses herself, she plays softball, she plays other sports, and she dances and she sings, and is truly just a miracle for us. And for those of you that are familiar with our clinic, this is actually one of the other providers, Dr. J, his youngest daughter. And so this story hits really close to home for many of us. And Carly's really kind of our poster child in the clinic, because she's a true example of what it looks like for someone to make changes to brain function. And it also shows just how impressive and how amazing it is with the way that our brains are designed, that we can make changes to how the brain is functioning. And so we want to talk a lot about that tonight in terms of how we do this, how do we go about that. Maybe you or someone you know is dealing with anxiety, or is dealing with a bout of depression, or can't focus at work right now. Maybe you have a kid or a grandkid or someone you know that's struggling with ADD and ADHD or autism. And so we want to provide hope, and that there's an answer for a natural and holistic approach to how we can help these patients out. So let's talk a little bit here about how this is done, and it's really this principle of plasticity. Many of you may have heard that. Sometimes the word neuroplasticity is out there. It's kind of a little bit of a hot button topic. And this idea of plasticity is really based on this principle of use it or lose it. So if we use certain areas of our brain and we work at it over and over and over again, we actually start to develop and build better connectivity and communication in our brain. Think of a kid trying to learn to tie a shoe, or riding the bike for his or her first time. they struggle at first and it's really challenging for them. But the more they practice at it and the more they continue to do it over and over and over again, they start to develop this connection within certain areas of their brain where it just starts to become second nature. And maybe for you and I, if we haven't ridden a bike in 10 years, we'd probably still be able to pick our bike up and go out for a bike ride and be able to balance on it and do everything that we need to, because when we were younger, that was ingrained in us over and over and over again. So really, it's not about the number of neurons or brain cells that our brain has. Really, when we're born with the most number of neurons or brain cells that we're ever going to have. And it sounds kind of sad, but from the moment we're born, we're minute after minute constantly losing our brain cells over a period of our lifespan. And so, again, it's not about the number of neurons you have, it's about the communication and the connectivity that you make with those neurons. And so, this is why someone like Einstein, for example, he just made billions upon trillions of connections within his brain that developed him to become a genius. And so, while we're not necessarily after trying to make people geniuses in the clinic, we are working at trying to improve the connectivity in certain areas of the brain to allow the brain to exhibit itself and function the way that it's supposed to. And this is what we were able to do with Carly over a long, long period of time, and many, many um, months and years of training for her. And so we can train our brain to do better, and we can train our brains to work better and better, but we can also do things to worsen our brains too. And so there's what we call positive plasticity, where we're building better connectivity and communication in the right direction. But there can be negative plasticity too, where we're driving connection, but for something that is maybe more of a negative thing, such as chronic pain, for example, or PTSD, post-traumatic stress disorder. These are examples of how we develop plasticity in a negative way, where now it might only take a little bit of sensation and that might be pain for us. It might be painful. And so this can be a really, really good thing. And this is the basis of what we do in the clinic in terms of making changes to someone's brain function. But there's also negative effects to it too if things aren't done appropriately for a patient. And so our goal is to break those kind of the chains of negative plasticity and be pursuing positive plasticity or positive changes so that someone can start to function the way that they're supposed to again. Now, when we talk about how the brain functions, I want to just give a little bit of an overview of this idea of what we call hemisphericity. And really, in our learning throughout the existence of Team Healthcare Clinic, this is one of the things that we stumbled upon and started learning in terms of what we can do to help not just Carly, but a lot of the patients that we see that come in with a lot of the difficulties I've talked about so far. And so, to give you just an overview, the brain itself has two different sides to it. We have a left brain and we have a right brain. And so those two sides have different functions. So the left brain, as you can see on the right side of the PowerPoint here, the left brain deals a little more with analytical thought, more kind of logical thinking, more science and math oriented. And so think of this a little more like your IQ brain. And it tends to be just a little more kind of the gas pedal, I call it. It's kind of the go, go, go. The right brain is much more of the brake pedal and kind of slows things down a bit more. This deals a bit more with more music and art and creativity and imagination. And so we see a lot of times where we'll see pretty big deficits and changes from one side of the brain to the other. Now, we all have a little bit of a bent or a tendency to being maybe a little more left-brained, it's called, or we might be a little more right-brained. But if that goes out of balance too much, we start to see issues showing up in terms of how the brain is functioning. So think of it a little bit like a band or an orchestra. And so there's many different pieces to the band or the orchestra, different members that maybe have different sounds, have different function, but they have to be playing together in sync, in tune, and rhythm for it to sound good. And if it doesn't do that, it's not going to make very good or very beautiful music. And in the same way, this is very similar to how our brain works as well. If it's not working in balance, if it's not communicating to one another or to each other, we might see a brain that, hey, one side's working like the Minnesota Orchestra and the other one is working like a middle school band. And So how well is that going to work? Not very well. And there's oftentimes a breakdown in how well the two sides of the brain are communicating with one another. This is just another example of what that looks like. This is just a great kind of drawing of the difference between that left brain and the right brain. And so as we work with patients, this is a huge part of what we have to identify with them is, are we seeing deficits in one area of the brain versus the other, or one side of the brain versus the other? And that's my job as a provider and practitioner in chiropractic or functional neurology, is how do I identify what areas of the brain are functioning appropriately, and what do we need to do to go in and actually make changes to that. So one story I want to share that's a perfect example of this is a patient I worked with a couple years ago by the name of Carolyn. And she came into the clinic after actually dealing with a bout of vertigo or pretty intense dizziness. And she actually went to another provider, went to a physical therapist, and had some care done. And she took care of the vertigo issue, which was great. But she was finding that after the fact, she was still dealing with some motion sickness. And so, as we examined and evaluated her and worked her up in our clinic, we found that she had a pretty significant difference in the functioning of her inner ear or vestibular system. And so we kind of had to go in and we had to hit that reset button and get things to balance out again. And so in her initial exam, when she came in, she would have just with her feet together and her eyes closed, she had a significant amount of what we call sway or movement side to side. And what was interesting is when we turned her head one direction, that actually picked up a lot more, where I almost had to catch her. And when we moved her head the other direction, she actually held completely still and had really, really good stability. And so this is just a perfect example of how we can develop imbalances in certain areas of the brain from one side to the other. And so when we did therapy and we did rehab with her, we had to go right in and actually work on activating that weakness and getting that to balance out so that she could have good stability. And if you actually search on our YouTube page, I believe we have this on our YouTube, a little before and after of her case. And after therapy and treatment over the course of weeks and a couple months, we got to actually balance that out and see very, very good stability with her. Her motion sickness was gone. Before coming to the clinic, she had an episode where she drove from work to a restaurant with some coworkers, and after 5 minutes in the car, she had to stop the car and actually get out and throw up. And so by the end of treatment, she had no issues with either driving in the car or riding in the car, which is huge for her to get her function back day to day. So this is just again an example of what it looks like for us to evaluate, to look for imbalances, and go in and actually treat that. And we'll talk more as we go along about what types of treatments do we do to actually accomplish this. Now, at kind of the root and the core of a lot of what we see in the clinic, these here being the prime examples, a lot of these conditions or disorders have um, different symptoms, but actually at the core, there's a very similar issue going on, and it's this brain imbalance that we have to deal with. And so, whether it be ADD, ADHD, autism, for example, um, typically this is an issue with the frontal lobes up in the front. And if you remember from what I just touched on with the left brain and right brain, it tends to be an issue with the right brain, which is again that brake pedal that helps just kind of slow things down. And so that side's not working as well. And so we tend to get a lot of that gas pedal, a lot of go, go, go. And we tend to have issues with more right brain functions, which is a little bit like deals with not just slowing things down, but it also deals with our nonverbal communication. It deals with our ability to pick up on social cues and to actually control our emotional behavior. And so these are why we see a lot of these symptoms showing up in kids, is because of this imbalance that's there. These kids tend to be very, very smart. They tend to do very well in school. They tend to be very regimented because that's a very left brain thing. And so we have to go in and work on getting that right brain to start to catch up so that it can actually start to communicate with the other side of the brain. Now, depression, anxiety actually tends to be a very similar thing. We see typically issues with frontal lobe activity up in the front. And what's interesting is what we tend to see a lot in the clinic is a lot of our patients that are dealing with depression or anxiety, we look back in their history, and not all the time, but a lot of times we find that they have a history of ADD or ADHD in their past, or issues with focus and attention. And this may have been diagnosed, it may have not been diagnosed, but a lot of times we'll see this correlation, and it makes sense because it's the same area of the brain involved, but it's showing itself differently in terms of symptoms later down the road. Um, Balance and dizziness, talked just a second ago a little bit about that, tends to be an issue with our inner ear, our vestibular system that helps to communicate to our brain about where our head is in space. Vertigo right along with that, and concussions can affect a lot of different areas of the brain depending on the site of impact, depending on the area that's involved with that. And so we have to go in and again evaluate that very in depth to determine what areas have been affected and what do we need to do to rehab that to start to get someone to start functioning better and better again. Okay. Now, what that led us into as we started to learn more about this idea of a brain imbalance and hemisphericity was there's much more that goes into working with cases of this than just the brain component. And so we do medical team meetings in our clinic 3 times a week with all the providers, and we oftentimes are talking about our new patient cases, the histories, what's going on. We talk about how can we work as a team to help with these cases, and then from there, we put together a treatment plan and a program for a patient. And so as I sat down and started talking to other providers about some of the cases I was working with and other providers were working with, we started to realize the importance of nutrition and chemistry with patients. And so Dr. Tim in our clinic, we often sit down and meet about our patients because it's crucial that we're not just looking only at the brain itself, but we're actually taking a look at a more holistic approach. And so this has led us into developing what we call our 5 pillars of health, or what I call our 5 steps to better brain performance. And so these are the steps and these are the pillars that we have to address with every patient that we work with to allow them to make changes to the way that their brain is functioning. And so what we often start with is by addressing the first pillar, digestive health, detox, gut health. Then we move into talking about nutrition with patients. We talk about and we address hormones, and then we discuss and teach on exercise and a lot of different changes to lifestyle. And this again is all encompassed around the brain health component, that 5th pillar. And so we feel very strongly in the clinic that if we're not addressing all 5 of these things, or if your provider's not addressing all 5 of these things, you might get some improvement. You might start feeling better and better, but we're probably not getting the very, very best care that we can for you. It's just so critical and imperative for us to be evaluating all 5 of these pillars so that we can help our patients with really getting the best outcomes that we can. And we've found this to really be a bit of our secret sauce in terms of the success that we've had with patients. And so let's dive into just a little more detail on these 5 pillars. So let's start by talking about the digestive or gut health piece. So the gut is really what we call our second brain. And so there's a connection between our brain and our gut, and it's through a specific nerve called the vagus nerve in our brainstem. And if our gut isn't functioning properly down here, oftentimes it's a result of what's going on up here in the brain. And sometimes it's the opposite, where something's not functioning right in our gut, that's not allowing our brain to function as well either. And so there's been a lot of research done on even autism, for example. Certainly Parkinson's is a big one where they're finding that a lot of the issues and symptoms that are showing up in terms of these conditions are actually likely a result of poor gut function, of what's going on in the gut or the digestive system itself. And so a poor digestive system and poor function in the gut is leading to issues showing up in terms of how well that brain is working as a result. And so we can't really treat these as separate entities because of how connected and in the communication that they have. And so oftentimes I tell patients if we got a gut that's on fire, that's not working right, whether it's constipation or diarrhea or issues with acid reflux, heartburn, issues with breaking down fat, for example, gassy, bloated, it's going to affect how well your brain functions. And a lot of times these patients feel foggy, or their memory's not as good, or they can't focus. And it's also the opposite too. So sometimes we see with concussion patients that an injury to the brain, they start developing issues with their gut later on down the road too. And really about 80-90% of neurotransmitters our brain uses for our communication, our sense of happiness and worth and well-being are actually made in the gut. And so it's super important that we're addressing someone's gut function when we're working on addressing their brain function as well. Now, kind of hand in hand with that, it ties in a little bit with the nutrition piece. And so digestive health, nutrition really kind of go hand in hand. And so we have to address a lot of different aspects of someone's health when it comes to the nutrition. And so this might be blood sugar. That's a big one that we see with patients. And so much so that Alzheimer's in the literature is starting to be called type 3 diabetes because of the connection between blood sugar dysregulation and memory decline or Alzheimer's disease itself. And so this is a critical thing that we have to look at with patients. Sometimes we have to remove certain pieces from their diet, whether it be gluten and wheat, dairy, corn, soy, sometimes egg. These can be very pro-inflammatory in large part because of how genetically modified our foods have gotten over the years. And so oftentimes we have to take this out of someone's diet and we have to work on removing that for a period of time so that we can get that chemistry right to, again, then allow the brain to start to make the changes that we want to make with it. And so that's just an example of some of the things that we do from a nutrition perspective. And we'll talk more about the specifics of how we do that. But again, I just want to give you just a little bit of an overview on the second pillar as we move forward. So let's move on to the number 3. This is hormones. Now, hormones, a lot of times people think of just our sex hormones and they think of hormones. And really, there's a lot more to the hormone story than just that. So we have our stress hormone, which is cortisol, and our sleep hormone, which is melatonin. And these actually have a very, very strong correlation with one another. And they work what we call inversely, where when one is high, the other should be low. And when the other one's high, the other one should be low. And so we'll see imbalances with this with patients that have issues with sleep especially, but also with patients that have high stress in their lives, and oftentimes that's correlating with memory issues for patients. And we'll talk about that a little bit as well. Thyroid is another big one that we have to evaluate. And we have to get deeper in terms of if someone's thyroid is off or their thyroid levels are off on their labs, why is that the case? And so often when we work with patients who have been to medical providers or other clinics and they've had labs done, or they've, oftentimes I get that, or, oh, I just had tons of labs done somewhere else and everything was normal. A lot of times we have to look deeper than what the medical profession is doing. And this ties into why a lot of times a lot of what we do isn't covered by insurance, because insurance is only going to cover things that they see fit as medically necessary. And a lot of times the function of what we are trying to address, the medical profession doesn't see as medically necessary. We run into this all the time, and it's very, very frustrating. But our goal is to help our patients. And so we have to dive and get past that and really doing what is very, very best for the patient and not letting insurance dictate what we do, which is oftentimes they are going to pay for drugs and surgery. And there's so much more that we can do to help our patients. So we can't let insurance just dictate what kind of care that we receive. And so with thyroid, for example, oftentimes the medical profession is only looking at TSH, which is thyroid stimulating hormone. And really all that's telling us is the communication between the brain and our thyroid gland, which is in our throat region. And so it doesn't tell us anything about the actual output of the thyroid gland itself. And so there's times with patients, I actually had a patient about a year ago who came in dealing with headaches and waking and couldn't lose weight. And that was actually a lot of the signs and symptoms of a thyroid issue. And after a series of adjustments over a month, we saw some improvement, but weren't quite there. And so we had to dig deeper. And so I asked her to get some labs done. And what we found was her TSH was actually normal, but her other markers of her thyroid function were off. We dug a little deeper and we found that actually she developed an autoimmune condition called Hashimoto's, where her body was actually attacking its own thyroid gland. And so what was extremely frustrating in this case was she actually went back to her medical provider with the labs, said, hey, what do I need to do? What should I do? And the provider said, well, nothing, your TSH looks normal. And I couldn't believe it. It was so frustrating because not only were her other thyroid markers off, but she had actually shown antibodies, or again, had shown that she had developed an autoimmune condition, so that she actually her own thyroid gland was attacking itself. And so we ended up admitting her into the clinic for care in our one of our programs to actually work on her thyroid and work on her chemistry. And after the course of even a month, but I think a couple months with her, we started to see not only was she able to start losing some weight, her headaches got better, she started feeling better, her brain fog went away, and she started to function more optimally again. And so this is just an example of one of many stories that we see where we have to look deeper when it comes to lab work, because so often the medical profession has such wide ranges in terms of what they consider normal, and we got to look at the function of that and say, what if we're between here and here? What can we do so that we're not getting close to the edge and we're not hanging off the cliff? But we want to work on optimizing someone's blood chemistry and optimizing their function. And so that's what we often have to do, is look deeper and just be a little stricter in terms of what we're doing with them. Now, one of the next pillars, the fourth pillar here, is exercise. And exercise, we all know the importance of exercise, but it has a ton of amazing benefits for not just brain health, but our whole body in general. It helps with reducing blood sugar, which we know is a big issue a lot of times for patients that are dealing with brain-based concerns. It helps with improving oxygen flow up to the brain, which is also critical if we're going to make changes to someone's brain function. Helps with hormone regulation. There's also a specific type of exercise called HIIT training, where if we do high intensity type interval training, we can actually do a lot of really, really cool and important things for the brain. And so this might look like um, going hard on an exercise, such as running on a treadmill or doing jumping jacks or push-ups for 30 seconds or a minute, and then giving yourself 30 to 60-second break to rest from that. And then you go for another 30 seconds to a minute, and then break, and then go, and then break. And so sometimes all you need, and what the research has actually shown, that is just 7 to 8 minutes of this type of activity has shown pretty incredible benefits to brain health. And so when patients that I feel like are appropriate for doing this type of exercise, I always try to recommend that because of the important benefits it has for brain health itself. And then that fifth pillar is, and this is again a large part of what we're talking about tonight, and that we're going to continue to talk through, is the brain health piece. And so what we found is we have to address those first four pillars in addition to the brain health piece if we're going to get the best outcomes that we can with patients. And actually, a patient that we worked with recently, her name is Robin. She actually came to our clinic due to really, really poor energy, but also depression and anxiety. And before starting on her brain-based treatment, we actually did a 6-week kind of gut repair phase with her. And what we found was, after just 6 weeks on only focusing on her gut and her diet and her nutrition, her depression went from an 8 out of 10 down to a 4 out of 10 in terms of severity. And that was before we even did anything in regards to her brain health. And so it just goes to show the importance of dealing with not just gut health, but digestion and nutrition, because that is kind of the fertilizer. It's kind of prepping the fields for what we need to accomplish when we start to move into our actual brain-based treatments or brain-based therapy. So hopefully that is something, if you haven't learned or known already, that you're learning right now, is just the importance of not just addressing or dealing with the brain itself, but also addressing and dealing with other aspects of your health. Now, big picture from this, when we talk about these 5 pillars and we address these, when I try to simplify it for a patient, I try to talk about activation and stimulation and fuel. And so activation and stimulation is the rehab and the therapy we need to do to make changes to someone's brain function and to improve that plasticity or that connection and communication that we're trying to improve with the patient. Now, if we're not addressing the fuel part of that, think of it like a car that's trying to move ahead. We're not going to make it very far in terms of our care if we're not continuously delivering fuel to that car so it can function and get further and further and further. And so when it comes to what we do, we have to address fuel in that nutrition and chemistry component, but we have to also address the activation and stimulation to drive and make changes to the way that the brain is wired. So questions we're often getting, and the questions that we're often having to address with patients is it too late? Is it permanent? It's a really important question to address depending on the patient's case. Certainly the younger the patient, the better opportunity that we have to make changes to the way that the brain is functioning. There's more brain cells, there's more opportunity for connection and communication to happen. And so think of it a little bit again about how when you're a kid, it's easier to learn things. It's easier to learn a new language when you're young versus when you're older. And so the sooner we can get our hands on someone, the better opportunity we have towards improving their health and making changes. Now, there's times with patients, whether it be a neurodegenerative disease like Alzheimer's or Parkinson's or something along those lines, that we have to be very upfront and direct that we're not going to likely make any changes in regards to actually reversing those conditions. Those are progressive. There hasn't been anything in the literature to show otherwise in regards to actually reversing those conditions. And so the approach that we have to take is how can we slow down and try to stop that progression as much as we can. And so that's the approach that we have to take with patients when we work with them with neurodegenerative cases. We have to work on stopping and slowing down the progression of that disease as much as we possibly can. Will it get worse? Think about for you, where's life for you in a year from now, 5 years from now, 10 years from now? Where could you be? Where have you been in the last year here? Have things been getting progressively worse? What do you need to do to make changes and reverse that? And we're going to talk about the ways that we do that and how we can help you with that in our clinic. And can changes be made? And the answer is yes. We can make changes to someone's brain and how the brain is functioning, and we do that every single day. And that's again the focus that I have with my patients. So let's talk about getting help. All right, how do we do that? How does that look in our clinic? Do you want to optimize your health? Hopefully you're thinking about that as you're going through and listening and hopefully learning through this webinar is, man, I feel like I need to make some changes to my own health, and I need to make some changes to my brain health. And so I want to encourage you to think about that as we move forward here. Is this something that you want to accomplish and tackle, and how can we help you in accomplishing that? So the way that we do that is we talk a lot about the 5 pillars that we've touched on, but now we need to talk about how do we take those 5 pillars and put that into a process and a really a protocol and a program to help a patient towards achieving better health and better brain health. And so we do this through what we call our 3 T's. So this involves testing. Talk a lot in the clinic about how we don't want to guess when it comes to someone's health. We want to make sure that we're running the right tests and that we're getting objective data and objective evidence to say this is what we need to be focusing in and doing for you. Our testing leads into what we do with our treatments and gives us the specificity of what we're going to do with their treatment protocol. And we envelope and wrap this all up in what we call teaching or health coaching. And this is an extremely critical and important part of any program with the patient, is that we're providing support, accountability, and mentorship. And we're going to talk about each of these here as we move forward. So let's first talk about the testing component. And so there's a lot of different ways that we test in the clinic and we do our evaluations with patients. One of the coolest ways that we do this in the front end is by doing what we call an EEG. And most people are familiar with like an EKG, which measures electrical activity of the heart. An EEG does a very similar thing where we're measuring electrical activity of the brain. And it's given us kind of a mapping of how different areas of the brain are functioning. And this often leads into a couple different treatments that we'll talk about in a second here. Neurofeedback is one of them, and transcranial magnetic stimulation, or TMS, is another big one. And so an EEG is a really, really valuable tool that we can utilize to actually give us some really important information and data to show us what areas of the brain maybe just aren't functioning quite as well as they should be. Neurological evaluations, I do that with patients as a bedside exam, usually 30, 45 minutes in length. Sometimes it can be a bit longer. And it's a very, very thorough evaluation, probably unlike one that you've ever had before, as we're evaluating different systems and different areas of someone's brain and body. Neuropsych testing, We often do this with our patients that struggle with depression or anxiety or PTSD. Brain span helps us to evaluate someone's omega-3 to omega-6 fatty acid ratios. So we're looking at anti-inflammatory versus pro-inflammatory markers. So it gives us a really, really good feedback in terms of how much maybe fish oils does a patient need. What can we do to up their omega-3s and start to create more of an anti-inflammatory effect so that we can reduce their inflammation and get them feeling better that way. We utilize a balance and force plate to objectively measure someone's balance. And we can start this at the front end. We can do treatment with it, but we can also do follow-up testing to make sure that we're on the right track in terms of improving someone's balance. And then there's a lot of different lab testing that we can do. And Dr. Tim typically oversees this in our clinic and as a part of our Brain Performance Center, where he's taking a look at a comprehensive blood analysis. He might be doing some different specialty testing, such as looking at some food sensitivity testing. And so I want to just give you just an example of what those look like in terms of some of the things he might be wanting to look at with the patient. This is what we call our functional profile. It's our comprehensive blood chemistry analysis. Again, this won't be covered by your insurance because your insurance won't see all of these as medically necessary for your case. And so typically, and this is just an example of how the insurance companies can kind of control things a bit, this is typically $2,400 if this was all submitted to your insurance. And it's a staggering number. Now, the cash price for this, you can see on the bottom there, is actually $275 if you pay cash. And so this is almost always what we do with our patients is we're running this entire thing because we don't want to just take a look at little snapshots here and there. We want to get a very comprehensive evaluation with them. Here's an example of a gluten sensitivity test. Oftentimes when medical providers test gluten, they're only looking at one type of response, and that's that immediate allergic response, which is really what happens with celiac disease. And so we want to look for more delayed sensitivities or responses that are happening over periods of time. So you might not feel it right away, but down the road, we might start to see that someone's gut's starting to break down or other aspects of certain parts of their body start to break down as a result of sensitivity to gluten. There's other types of foods that we can test that look very similarly to gluten. So that might be dairy, that might be corn or rice, for example. Coffee and milk chocolate and egg and soy are on here. There's a lot of different ones that we can evaluate and test with the patient that give us a deeper understanding and a deeper look at what's going on. Here's an example of a stool analysis. Depending on how much is going on in terms of the digestive process and how much of whether it's constipation or diarrhea or bloating or gassy. Sometimes Dr. Tim will order up a stool test and we'll actually evaluate that to look to see if there's any infections, see if there's any inflammation or imbalances in terms of someone's gut flora or the bacteria that's in the gut. And we need good bacteria in our gut. That's super, super important. And sometimes we see that just way out of balance. And there's things that we need to do from a treatment standpoint to address that. And then here's an example of a cortisol test. And so cortisol, again, is our stress hormone. Gets elevated and is very high with high amounts of stress, which we see more and more and more every single day in our clinic as patients that have issues with stressful lives. And so stress can have a profound impact in terms of brain function. And the area that stress actually impacts the most, and that cortisol here actually impacts the most when it's elevated or too high, is actually our memory centers. And so typically high stress situations, but chronic long-standing stress over a long period of time can significantly impact the area of the brain that deals with our memory and also our sleep. And so a lot of times, again, when we have issues with sleep, we're going to test this with the patient to determine if we need to do some things to help with that. Now let's talk a little bit about treatment. We touched on the testing component. The testing then leads to what we do from a treatment standpoint. The two big treatments that we do in the clinic are EMS, transcranial magnetic stimulation, and neurofeedback. I want to touch on each of these here for a second. EMS is actually it's a literal medical grade magnet that we use. It's about this size, and it's actually placed up against the skull in a particular area, depending on what the EEG shows us. And there's an actual magnetic impulse that is transmitted through the skull into the brain. that works on either trying to increase how well an area of the brain is working, and we're going to get it speeding up more and more and more, or we can set it to a specific a specific frequency to actually help slow down the rhythm of the brain. And so sometimes we need to speed things up, sometimes we need to slow things down. And so it works with the actual brain wave patterns to help with balancing out, again, areas of the brain that are just completely out of balance. It's much more direct. It is a very intense treatment protocol. It's actually 5 days a week, every day for 6 weeks, and that's what the research and treatment has been done on. Places like Mayo Clinic and Johns Hopkins and a lot of these big hospitals are using this for major depressive disorder, especially. And we use it for that, certainly. We also will use different, use it for other conditions too, whether it's anxiety or sleep. Those are probably the other big ones that we utilize it for. Neurofeedback is not so direct, it's more of an indirect treatment. And so you're actually wearing the same cap that we use for an EEG. And this time we're training a specific area of the brain. And so, for example, we might train the frontal lobe. And so it's measuring your real-time brain wave activity. And so at the same time, you're actually watching a movie or a video. And when your brain fires appropriately, the way that it's supposed to, you're going to get rewarded by seeing more of the movie or more of the video appear. And if it fires out of balance, again, the video actually will fade away. And so there's this in and out that's happening in real time as you're watching the movie or video, as your brain is training itself to actually fire the appropriate way. It wants to see more of the movie, and so it's seeking that reward, and it wants that reward, and so it's training itself to have the appropriate brainwave pattern and to start to function appropriately again. In comparison to TMS, which is a daily treatment for 6 weeks, neurofeedback is twice a week. Both these treatments are in trainings are 25 to 30 minutes. And neurofeedback, we're finding our best results with 40 treatments. And so at twice a week, this is often about 5 months of care for a patient. And it takes time to make changes to the way that the brain is functioning. And so these are probably the two biggest things that we utilize for a lot of different cases with our patients. And this is what's really allowed us to push forward in terms of our success. In addition to that, we're often looking at different types of brain-based therapy. So this is a lot of what I do with patients when it comes to brain-based rehab, whether that be looking at eye movements and working on specific eye movements, working on balance training or vestibular type rehab, sensory processing, especially with kids, we'll do a lot with this. Anything we can do to make a change to the way that brain is functioning, we're going to utilize and do that. So this might even mean utilizing adjustments, chiropractic adjustments to do that. For some patients, acupuncture. For others, physical therapy. And obviously nutrition is a big component, wrapping that all up too. And this is, again, the focus of what Dr. Tim does with our patients when we work with them together. Now, the third T, we've touched on testing, we touched on some of the treatments we do. That third T that we have to incorporate into our 5 pillars is the teaching or health coaching component. And this is, again, something we've only been doing probably for the last year and a half, almost 2 years now, but has been so critical in terms of getting the success that we have, is giving patients accountability and some mentorship, teaching, educating them on what it is that we're doing and why we're doing what we're doing. And so we teach and educate around our 5 pillars so that by the end of someone's treatment plan and program, that they feel like they have the tools to continue with improving their health and maintaining what they've gained over the course of their treatment. And so this is an extremely important piece of any plan and program that we do. Great Chinese proverb that just summarizes that up. Tell me, and I may remember. Show me, and I will remember. But involve me, and I'll understand. And that's what we want for our patients. We don't want to just be telling them what to do and kind of drag them along in terms of their program. We want them to be invested and to start to understand and learn what we're doing so that they feel like they have some skin in the game and they can actually take this forward with them for the rest of their lives. And so, again, I just cannot stress enough the importance of having that health coaching component and our health coaches that help our patients out in this way. All right, now, as we're getting towards the end here, I want you to think about these for yourself and ask yourself these questions. How would I be if I were able to, and how would life be if I were able to resolve my health issues? How has my life been affected? It might be at work, it might be relationships that you have. You might just not even be enjoying life due to what it is that's holding you back. Think about what that is for you. On a scale of 1 to 10, this is a critical question. How motivated am I to really take care of the problem? We talk a lot in the clinic about how we need to have A or B type students to accept into our programs. And sometimes we come across C students, and that's okay if that's where you're at. But it's just probably not the best fit for us. And what happens is we tend to get frustrated with the patient because they're not pulling their weight and doing what we're asking them to do. But the patient gets frustrated too because they feel like they're not getting better. And so we need to have an A or B type student, someone that's a 9 or 10 out of 10 in terms of motivation, willing to do what it takes, willing to make the changes that we're asking them to make so that we can really have the best opportunity for a great outcome with the patient. And so this is a super, super important part to think about. So we've touched on a lot throughout the course of this webinar. There's a lot of information that I've gone through with you guys. Hopefully I've kind of hit on my first promise that you've come away learning something new tonight. The second promise that I said was I want to make sure that I offer an opportunity for you or someone you know to get help. And this is the reason why I do what I do, and this is what drives me every day, is the opportunity to help patients, especially those that are struggling with poor brain health. And so I want to offer that opportunity for you guys, and it's part of our what we call our transformational wellness evaluation. And we want to work at making transformational types of changes for our patients. And so this involves a 30-minute consultation. We typically will hand out paperwork either in advance of that visit or after that visit, and we'll go over some specific forms that are addressing brain health and gut health. And this helps direct us in terms of what it is that you need for your care specifically. And so with these forms, with discussing and talking about your history, we'll actually sit down, we'll put together a plan of action that a unique and specific treatment plan and program for specifically for you on that visit. And so this visit typically is $140 for 30 minutes of our time in the clinic. But for right now, for this webinar, especially during this COVID time, we're offering this at a significantly discounted rate at $29. And so just know that this can be done either in person in the clinic. We're still open right now, and we're still seeing and treating patients and following all the CDC guidelines to do that. If you feel more comfortable doing this consultation over the phone or over a video platform such as Zoom or FaceTime, I'm more than happy to sit down and do that for you guys as well. And so remember, again, I'm here to help you guys and to really make changes to your health and specifically your brain health. And so I would just love the opportunity to sit down and meet with you and discuss how we can be a part of that journey for you, and we can make changes to not just your health, but really your life as a whole too. So please feel free to put any questions you have down now. I'm going to hand it over to Lexi, and she's going to talk just a little bit more about how you can take advantage of this consultation. And if we have any questions, I'm just going to hang around and I'll pop back on and answer any questions that you guys have. So I'll hand it over to you, Lexi.
Thanks, Dr. Starr. We know that truly is your heart, is to help patients with these type of brain balancing conditions. So thank you for sharing tonight. Yes, like you mentioned, this consultation is for tonight. And we are discounting it, like Dr. Starr mentioned, due to the COVID season and just for being an attendee on the webinar. Like I mentioned at the beginning, I did put the web page that you'll want to click on in order to move forward with this consultation. So it is in the chat at the top. It is teenhealthcareclinic.com/brain. It is also found under offers on the right side of your screen as well, probably under the chat feature. There's an offers button. And if you just click the blue schedule a consultation, it will bring up a new web page that again will link you to registering for the consultation. $29 for 30 minutes of Dr. Starr's time to review some of the things that he talked about and see if you're a candidate for treatment as well, or someone that you might know might be as well. So I did have a couple questions for Dr. Starr. that came through. If you have any additional questions, please feel free to type them in. We'd be happy to get to them in just a second here. But the first one that was messaged to me, now if it is a child that is coming in for a consultation, did you want them to be in attendance as well?
Yeah, that's a really good question. I get that a lot with parents, especially wanting to discuss their child's condition of ADD or ADHD or autism, and it really depends a little bit. And I try to give us a little leeway with that, depending on what the parent prefers as well. It is helpful at times with, especially like an ADD or ADHD patient, to just get a sense of what they're like and how they interact and what they're like in the room. We do have a family room in our clinic, so a lot of times we'll direct patients into that room, and there's typically toys and things that they can do in the room to maybe keep them occupied while I talk with the parents during that visit. If you feel like it's going to be a major distraction during that visit, and we're not going to be able to get through the things that we need to discuss and get through, sometimes we'll do this with maybe more of an autistic kid, for example, who just needs a little more attention. Sometimes we'll just say, hey, leave them at home, just come in, let's discuss their case and their care. We've worked with a lot of kids in a range of different severities, and so we know typically, again, what's going on and what we need to do with them. And so that might be a case where if you feel like it's best to just keep them at home and to come in and talk and be distraction free, sometimes that's the best thing too. So a little bit of leeway on that. Both can be beneficial in their own right. So I try to give the parent the discretion on that one.
Okay, thank you. That makes sense. Another question that came through is, do you do supplementation in addition to managing the diet? If you want to expand on that a little bit.
Yeah, absolutely. So supplements are a huge part of what we do from a nutrition standpoint. And everything that we utilize and everything that we do from our gut health to our brain health, the supplements we utilize have been backed by a lot of research. And so there's specific supplements that we use from a couple different companies, but can be a huge assistance for us. And when it comes to reducing inflammation for a patient or starting to regulate certain hormones, we try to avoid, again, the use of drugs and medication for those things. We want to get to the root cause of what's going on, and also utilizing some more natural and holistic means towards accomplishing those purposes. And so we always include that in someone's treatment plan or program. There's always a certain amount that we set aside for supplements themselves, because this is a really valuable tool for us, and we can get a lot accomplished by utilizing that.
Great, thank you. And the last one that I received here too, how often do you suggest getting lab work done if there are like thyroid concerns?
Yeah, it's a really good question. We actually, in our program itself, we talked about that functional profile, the comprehensive blood analysis. There's like 60, 70 different lab markers on there. We typically include a couple in our program because we want to do a little bit of a before and an after to make sure that the things that we're doing are making changes to someone's chemistry and their health. And so it a little bit depends on the discretion of Dr. Tim in the case and what he's doing. So it's not always a perfect answer for that. There's sometimes after 3 months, he wants to run an evaluation or another lab to compare. Sometimes it's more like 6 months. If it's more of a wellness patient who has gone through a program with us already and now is at more of a maintenance level and just maintaining their health, that might be once a year. But typically, it's probably going to be somewhere between every 3 to 6 months. We're going to run a reevaluation on someone's labs or their blood work to take a look at changes that we're hoping to be making with them through the program.
Excellent. Thanks so much. Well, thank you everybody once again for attending tonight's webinar. We hope you took away some new information and just a sense of hope too, that we can truly help you and are interested in serving you. And so feel free to take advantage of the consultation that we are offering. And we appreciate you attending tonight. We hope you have a wonderful night.
Thank you.